I think St. Elizabeth's is an ideal place to come and get your urologic care. We all have strong backgrounds in general urology, but we all have our own specific interests as well.
My focus is urologic reconstruction and also urologic oncology. A lot of what I do is rebuilding the urinary tract either after cancer or after an injury or radiation or something like that. I think what makes us special is that we are able to give people the time that they need to help figure out a plan that works for them. It's not a cookie cutter kind of approach.
I specialize in female pelvic medicine and reconstructive surgery. I am bringing to the group a focus on women's health and surgery for women-specific concerns within urology. Sometimes in such a sensitive topic, women are a little more comfortable seeing another woman, so that can be really helpful.
My specific interests are with benign prostatic hyperplasia, as well as kidney stone disease, as well as really all of the urologic oncology patients as well. Urology appealed to me because I think there's a lot of different ways you can improve patients' quality of life.
I practice a very specific part of urology. I do voiding dysfunction in men and women, people who go too much, go too little, or can't control their bladder for one reason or another. Getting up at night, having episodes where you can't make it to the bathroom on time is very, very common. 30% of people probably complain about it at some point in their life.
After residency, where you kind of learn all of urology, I did an extra 2 years of fellowship to learn urologic oncology. Also sort of have a focus on the robotic side of it, just because a lot of our cancers are treated minimally invasively with laparoscopic and robotic techniques.
It's that team approach that I think is what makes us successful, and I think that's what makes us unique.
Some of the cases and conditions that I see in the clinic most frequently are general urology sort of cases, and those are most frequently things like enlarged prostate with subsequent issues with urination that comes from that, things like overactive bladder, urinary tract infections, sometimes initial consults for kidney stones. Down in the operating room, there are frequently cancer-related cases that I'm involved with.
We do all urologic procedures here on site, and we can offer most comprehensive care to our patients here at St. Elizabeth's. I see patients that speak only Russian. This is very beneficial because it's not only about interpretation, it's about also culturally understanding people, and they feel more connected with you.
Every patient has a different path. They have a different set of needs, and so tailoring the care that we provide to each individual patient is essential.
I think St. Elizabeth's has this nice balance between being big enough but not too big. You have that nice meeting of quality and convenience, not trading one off for the other, and patients seem to respond to that.